The insulin therapy is one of the most effective ways to manage diabetes. Yet it's surrounded by very fear, confusion, and lots of misinformation. From the myths like insulin is last resort to once you start, you can never stop it. So misconceptions. But in today's session, we will debunk the most widespread myth and shed a light on real facts about insulin therapy. Whether you are recently diagnosed or currently on insulin or supporting someone with diabetes. So basically this conversation will help you better understand how insulin works and why it's a life-saving tool, not something just to fear. So today we have Dr. Sudhir Ranjan Samal with us to help shed light on various myths surrounding the insulin therapy. Dr. Sudhir Ranjan Samal is a consultant diabetologist based in Rourkela, Odisha, with a strong academic and clinical background. He holds MBBS and postgraduate diploma in diabetic management, equipped him with both international insights and deep practical experience in treating diabetes and other endocrine disorders. Over the years, Dr. Samal has been committed to empowering patients through accurate diagnosis, compassionate care, and personalized treatment strategies. His work focuses especially on managing diabetes with the evidence-based approach, helping patients overcome challenges and live healthier, more confident lives. So we are very grateful to have him here to share his knowledge and help clear up the many misconceptions which are revolving around the insulin therapy. So Dr. Samal, before going further, would you like to add something from your end?
Good evening, and thank you for giving me this opportunity to on this platform to aware my patients and myself, Dr. Samal from Rourkela. And we all know that this insulin is a fear for all the patients. And when insulin is prescribed and the patient is out of his sugar control, he thinks that he is being punished by giving a prick or 3 or 4 pricks per day, like just hitting the horse to control to run more, and so that the patient will get controlled. And also the patients have the fear that my days are being counted. So there are many myths, and today I am very glad to share my views. Thank you.
Yes, thank you so much, Doctor. So we'll start with the conversation. So, Dr. Samal, one of the biggest concern is that patient is once you started the insulin, you are on it for life. So, is it true or is it kind of myth?
No, it's just a myth. And that when insulin is prescribed, people think that once a insulin and they will be lifelong for a insulin, and they think that that will become a addiction or a dependence, and so they avoid it. But the conditions are such that there are many conditions where diabetes is being so insulin is being prescribed for diabetes. Number one is, we all know, type 1 diabetes. This is where insulin has to be given lifelong, because in the patient the cannot produce insulin from his pancreas. And number two case is disease progression, where the diabetes progresses and insulin production may be decreased with the days to come. Because when a patient is diagnosed as diabetes type 2 diabetes, 50% of the pancreas is already destroyed. Beta
Okay.
cells are already destroyed. So in this case, the addition of insulin is being given, and this may be temporary or may be as required. Suppose a patient is for 10 to 15 years old, almost his beta cells are exhausted, so the rest of the life the insulin may be prescribed. But there are some cases when the starting of the day one, when a patient comes with 300 or 400 fasting blood sugar, very high, newly diagnosed case, due to sugar congestion in the beta cells, in the pancreas, the insulin is prescribed for a month or two, so that the insulin secretion increases and the sugar concentration in the beta cell is reduced, and then the insulin may be discontinued after a month or two. So once a insulin is never a insulin. Another condition is GDM, that is during pregnancy. Here, the cases from the start of the pregnancy, the insulin is to be prescribed for the healthier and safer mother and child. So, the insulin is being prescribed and the insulin will be discontinued after the delivery. And there are some conditions like, suppose a non healing ulcer or a pneumonia or some hospitalized conditions where insulin is to be prescribed for the better recovery of the patient. So this is also a transition. So there are many transitional phases. So the patients need not be afraid that once a insulin is a lifelong insulin. So this is totally a myth. Thank you.
Clearly, it's a myth. Also, doctor, many people believe that insulin is only for the people who are with the severe diabetes. Like insulin and diabetes go hands in hand. But can you clarify when and why insulin therapy is actually prescribed, as you previously said some examples?
Yes, like in my previous question also, first we'll break up this question when and why. First is
Yes.
when. When the insulin is to be prescribed. Insulin is to be prescribed. First is type 1 diabetes, where, as I told, that pancreas does not produce insulin. So, the insulin has to be prescribed in the younger adults, type 1, and for lifelong. And type 2 diabetes, insulin may be prescribed when and when other treatments totally fail. And in these conditions, this when a person without diet control, without exercise, and with irregular medications, the blood sugar goes out of control, then insulin is to be prescribed. And the third one, as I told earlier, the GDM or the pregnancy with diabetes, that is also a for a temporary period, the insulin is to be prescribed. And in between also, there are conditions when high blood sugar cases come after the mango season. People go for taking more number of mangoes and the sugar is out of control. In that condition, insulin may be prescribed, and due to illness, stress, and with irregular medications, insulin has to be prescribed. And why insulin is to be prescribed? This is the blood sugar levels. When the insulin regulate the blood sugar levels and reduce the risk of complications. And for symptom management, when there is sugar is being controlled, but there may be more thirst, more urination, loss of weight, in these conditions also insulin is being given so that the body restores back. And for preventing complications, like there may be nerve damage, tingling of the nerves, burning sensation in the feet, and kidney damage, kidney problems, and even vision damage, there may be complications in the eye. In that cases, insulin is to be prescribed to control the complications. And so when HbA1c level goes more than 8 or 8.5, insulin is to be prescribed, and the patients need not be panicked that this will be continued for a longer time. So they have to talk to their doctors that this may be for a temporary time. And there are also many times that people think that this insulin, how long they have to take. For
Yes.
a normal period they have to take it, and they can discontinue. And there are also many constants for the patients due to their lifestyle also, some also due to financial conditions. They may discontinue the insulin, but they have to talk to their doctor. They will accordingly give them some alternate medications like OADs, oral diabetic drugs, so that that will be managed. Thank you.
So, doctor, is it true that insulin causes weight gain or damage to the kidney over the time?
With the start of insulin, there is a weight gain, because insulin causes weight gain, that is true. But with the uncontrolled diabetes, there is loss of weight. When the body regains the natural way, then the there is gain in weight. Like a tuberculosis patient, when a tuberculosis drugs are given, there is gain in weight, because the body restores back to its normalcy. So actually the weight gain is not always due to this insulins. And nowadays newer insulins are available, which are totally weight neutral, and these are bit expensive, but these are weight neutral. The older human insulins are uh, have a weight gain, which is a side effect. But with
Okay,
diet and exercise, this weight can be controlled. With normal behavior of the routine life, this weight can be also managed.
thank you, doctor. So, as in the
And
introductory
another part
part,
is kidney damage. Another part, I missed the kidney damage. Yeah, regarding kidney damage, totally it is a myth, and there is no such evidences that this insulin causes kidney damage. But during kidney damage, insulin is being prescribed to prevent further kidney damage. And also, before the kidney damage, if a patient is being prescribed insulin and is agreeing to take continue the insulin, then the kidney damage may be delayed or may not be there.
okay, thank you so much, doctor. So, I was saying that in the introductory part itself, we talked about the fear. So, some patients hesitate to start the insulin because of the fear of injections. So, are there any alternatives or ways to make it less imitating?
Yes, uh, the insulin nowadays are available with very advantageous devices are available, like the insulin pens, which are very much advanced, and the needle which are being provided with the insulin pens are very fine, and these are 32 gauge needles, which are totally painless. And nowadays the insulin pumps are also available, which have a single prick, and they continue to deliver insulin throughout the day, and no need of multiple injections. And there are also jet injectors, which are, and also jets insulin sprays, but they are not readily much available, but they too are painless. And so making this insulin delivery painless, the patients can talk to their doctor. The doctor can, or the dietitian, or the hospital attendant, or the sister, they can teach the patient how to give a better insulin in a better procedure, like rotating the insulin sites and proper way to administer the insulin. This can be learned, and this will elevate the fear of taking insulin.
Okay. So, doctor, we would like to hear that what advice would you give to patients or caregivers who are struggling with the insulin management or feeling overwhelmed by it?
The For the patients first, the patients should not be afraid to ask for help. They should communicate with their doctors and the healthcare providers or the diabetes educator. And they should always be started with small dose, and slowly it has to be increased, because the fear of getting hypoglycemia is always with the patients. And the progress of the patients should be according to the advice of the doctor, like follow up after a week or 5 days or after 15 days. so that slowly the insulin can be elevated stepwise, and the fear of hypoglycemia won't be there, and they would have a good quality of life. And for caregivers, the patient attendants, they should always have a good emotional touch with the patient. They should not panic that देखो तुमने खाया नहीं और उल्टा पुल्टा खाया, अभी इंसुलिन लग गया. This fear should not be given to the patient. This should have a emotional touch that no, we have, the doctor has given this insulin, and with empathy we have to tell them that with this will be stopped after a few days or a few months, and you should have a good life. And with this, you will, your organs will be protected, and you have a longer life without any events. And I always tell my patients that if you have any problem regarding insulin, get in touch through my WhatsApp, chat with me, and or call me up, so that anytime you have a, suppose when giving a insulin, you, a drop of blood comes out, they have a very fear that blood has come up or anything problem like that. You can call me up, so that always in touch, and the patient will slowly get used to it, used up to the insulin, and will be totally comfortable.
Yes, thank you so much, doctor, for this advice. And also, I guess with the medications, the emotional support from the loved ones should be there always,
Yes.
right? So, doctor, my next question is apart from this needle and injection, do natural remedies or some oral medications work better than insulin in the long run?
No, for long run, always insulin is better, because
Okay.
I tell insulin is insurance for your organs. Because any event in our lifetime, suppose a myocardial infarction, or there is a cataract in our eye, or some problem in our retina, or kidney damage, or any heart problem, any problem is there, or a non-healing ulcer is there in a leg, then we are being prescribed insulin. So why not go for insulin before that, when our sugars are getting uncontrolled with our oral medications? And we should ask the doctor that please give us a insulin, and we can stop the insulin also after few days.
Okay. Thank you so much, doctor. So, is it true that insulin needs to be taken at the same exact time every day, or is there some flexibility over it?
Yes, like human insulins are to be taken at the fixed time, but the newer insulins which are available, like the degludec or the other insulin, the newer analogs which are available, they can be given any time of the day. And many insulins, they have at least 3 hours to 4 hours window period also. Suppose a insulin has to be given at 8 p.m., then before 3 hours and after 3 hours window period of 6 hours are also available. And the many insulins are there. If the insulin is missed today night, then it can be given tomorrow morning also without any problem.
Yes, that's the main information I guess we needed. Also, doctor, can you please tell us, are there any common mistakes which people make when using insulin that can be easily avoided also?
Yes, there are few mistakes, like people do not follow the guidelines of the doctor. Like the one is the time, another is the site. Randomly, people go on putting the needle left, right in the leg, and they do not give a good spacing of at least 2 fingers from one side to another side, which is a very easy way to remember. 2 fingers gap from one point to another point, so that when they come back to the same point from their thighs, abdomen, and both the arms, they return back to the same place after 3 months. So the wound is totally healed up. And lipodystrophy, which is a common problem when the this proper usage of the insulin is not being followed, that is fat accumulation at the injection sites.
Okay, which is more harmful for. the patient. Right. Thank you so much, doctor, for this introduction and the ways you are telling that how the insulin should be taken on and not. So, as we wrap up today's session on myths and facts about insulin therapy, a heartfelt thank to Dr. Sudhir Ranjan Samal for his time and expertise. His thoughtful insights have helped us break down the fear and many misconceptions around the insulin and remind us that with the right information, insulin therapy can be safe, effective, and even life changing tool in managing diabetes also. To our wonderful audience, thank you for joining us. We hope this session has not only clarified common myths but also empowered you and your loved ones to make informed decisions about diabetic care. Remember, understanding your treatment options is the first step towards a better health and better outcomes. So stay tuned for more expert-led conversation on managing chronic conditions and living well. Until next time, take care, stay informed, and don't forget to follow us on social media handles and channels for more updates, tips, and wellness inspirations. Dr. Sudhir Ranjan Samal, once again, thank you so much for joining with us and sharing your knowledge.
Thank you very much.